Hello, my name is Dr. Jim Bellamy. I'm Program Director for the Bachelor of Science in Health Services Administration program, as well as the Bachelor of Science in Public Health. I just wanted to talk to you today about the two programs and what we, as an institution, ODU, can offer you. So the first thing I wanted to talk about are what we offer. What are the two programs we offer in Health Services Administration? The two programs are what I term regular, which is for people just coming into the healthcare system that has no experience in healthcare. And then the other one is a professional, which these are people that actually work in the healthcare professions right now that have a current license or registration. They also have an Associate of Applied Science degree. Both of these degrees are really management focused. How do we take the resources that we have in healthcare and distribute those to the best effectiveness for those resources? When we look at the Bachelor of Science in Public Health, it's much more science focused, it's much more community oriented. So while the two degrees are very closely related when it comes to the healthcare system, they diverge and look at different aspects in society, whether we're talking about management of individual institutions, healthcare institutions, or we're looking at how do we make our communities healthier. One thing that I did want to mention about the BS in public health, in a lot of ways, since it's so science-based, you can think of it as a gateway degree that can allow you to go on to different things, such as more professional degrees, such as PA program, pharmacy, and we also have a program that you can go from your BSPH, your Bachelor's of Science in Public Health, directly into your Master's of Public Health, your MPH, and complete that in 1 year instead of 2 years. All of our courses are offered online, so both programs are totally online. There's no on-campus visits required. So for those people that are working, it provides a lot of flexibility for you and your schedule to complete a degree here at ODU. Then we start thinking about, well, what do we do at ODU? What's our faculty doing? What sort of undergraduate research opportunities are available for our students? Currently, right now, of course, with COVID, a lot of what we do is related to COVID, especially whether we're talking about who actually gets COVID. You know, what are the health disparities that lead to more people getting COVID in socioeconomic conditions? How do we distribute the vaccines and that type of thing? However, prior to that, believe it or not, there was research going on that looked at health disparities, mainly here in the Norfolk area, which is something that's very near and dear to all of us in public health and health services administration. How do we help people lead healthy, happy, and productive lives? So that's one of the things we looked at here. And so, you know, it's like when you think about health disparities, one of the things they're looking at is housing, transportation. Those are things that we look at and how that affects people's health, whether we're talking about the community's health or an individual's health. So a lot of different research is going on. Primarily right now, we're focused on COVID. As a matter of fact, one of the undergraduate research opportunities right now is working with the Virginia Department of Health, looking at how do we distribute vaccines? How do we distribute vaccines to lower socioeconomic people to make sure that they get access to the vaccines as well? So there are a lot of different things that we're looking at, mainly related to health disparities. One of the things we can do that we suggest students do to get some practical experiences, join the Medical Reserve Corps. And that's a state-run volunteer agency that allows people to get out into the community and help everybody in their community. And that's one of the things that the MRC does, is provide vaccines. So they also do some contact tracing and those types of things. But even beyond COVID, there's always some sort of need in the community, and the MRC steps in to help that. One thing that every student does, whether you're talking about the Health Services Administration degree or the Public Health degree, is that every student has an internship, has to go through an internship. That's typically in your last semester. And we look at that as the bridge from your academic career into your professional career. So it's actually a very important course. In many instances, that internship actually leads to employment. For example, recently we had one of our students do an internship at Johnson & Johnson, a major corporation that deals in all sorts of healthcare. So great experience. We also have students that are doing internships at the Virginia Department of Health in all sorts of different aspects of public health, whether you're talking about being a public health educator, an epidemiologist. An epidemiologist traces disease, which of course you can imagine they're pretty busy right now when it comes to COVID. So that internship is very important, and it's a requirement. So keep that in the back of your mind, that we actually get you out into the community working with people, which is a very important aspect when you're talking about healthcare and public health. So with that being said about the two professions, so what's the employment outlook for those professions? For health services administration, you're talking about an 18% job growth in the next 8 to 10 years, with that coming out to about 50 to 60,000 new jobs all across the country. So health services administration is in demand. When you think about it, people think, okay, health services administration, I'm going to work in a hospital. Well, you can work in a hospital. You can work in different departments of the hospital, managing those departments. You can work your way up to be the CEO of the hospital, which takes years. You have to gain experience. But then there's also local facilities, physicians' practices, dentist practices. So it's not just working in a hospital. There's also, you can work for outpatient facilities, such as outpatient radiology facilities. So there's a lot of different opportunities. When we look at public health, once again, another big job growth, approximately 18%. So it's the job growth is about the same as it is for health services administration. So what can you do with public health? You can be a public health educator, the epidemiologist, as I said, health policy analyst. That's the one thing that I went to school for. Not everybody likes policy, but to me, all roads lead to policy. So if you do studies and you determine that something needs to be done publicly, you have to have a policy for that. So you need to make sure that policy is working correctly. The salary for new grads for the BS in public health is anywhere from $45,000 to $60,000, depending on what you do. Epidemiologists tend to be a little bit higher paid. So both professions have a tremendous growth rate in front of them. So there's a big demand. And I hope you guys consider coming to Old Dominion for either your health services administration degree or your bachelor's in public health. Thank you.